At least 1,000 nurses and midwives have been exposed to the coronavirus disease in Nigeria. 70 of them have so far tested positive, and at least 6 have died. The Nurses and Midwives Association is now seeking better working conditions as frontline health workers in fight against the disease. Lara Folayon has more on this.
Yes, I'm proud to be a nurse.
The Nigerian Nurses Week for year 2020 has just ended, and these nurses and midwives see this as the right time to make known their occupational frustrations to government. They are particularly concerned about the number of members already infected or have died from the coronavirus disease while in the line of duty. The World Health Organization standards allow for 14 nurses per 100,000 patients, but in Nigeria's case, it is 5 to 6 nurses to that population. More worrisome is inadequate knowledge on COVID-19, as well as the use of personal protective equipment by the healthcare providers. This largely explains why the infectious diseases principle and protocols are sometimes violated, thereby unduly exposing them to infections. Poor working conditions have not also helped matters.
The government and the PTF need to be sincere. For today, it is difficult for the federal government of Nigeria to showcase the statistics of people who are actually working on ground. You are a living witness when a highly placed government official in this country was at the House of Rep and he was being asked, and the person cannot confirm or justify the issue of payment of hazard allowance.
These healthcare professionals are now seeking an improvement in working standards. They as well want life insurance policies, payment of salary arrears, capacity building, as well as improved synergy between relevant stakeholders on finding a lasting solution to the coronavirus disease.
The Federal Ministry of Health to release without further delay the withheld salary of our members, especially in the federal health institution, to formulate policies that will reduce disharmony within healthcare professionals by ensuring justice, equity, and fair play in the health sector. Provision of the modern equipment infrastructure and adopt modern ICT in health sector to improve Nigerian health sector performances and learn from the lesson of COVID-19 that nowhere is better than our home indigenous healthcare system.
The nurses and midwives are worried that the healthcare system has been overstretched and on the verge of being overwhelmed. They now want more investments committed to that sector for a needed upgrade and facelift at the moment. The nurses and midwives are hopeful that their demands are given urgent attention by the authorities for the benefit of the healthcare system, as well as in controlling the spread of the coronavirus disease. Lara Folayon, TVC News, Abuja.
Joining me now via Skype from Abuja is the president of the National Association of Nigerian Nurses and Midwives, Comrade Abdurafiu Adeniji. Comrade, it's good to have you join me right now. From the records we have seen and the reports that we have been receiving, there's a lot of money is budgeted by the federal government for the safety and welfare of workers, especially those in the front line. Now, you are in there. Talk to us basically how that is translating to the safety of frontline workers at this time.
Good morning and thank you. The scourge of COVID-19 has exposed a lot of issues when it comes to health sector in Nigeria. Point number one is that the health sector is not well.
All right, we seem to have lost the feed from Comrade Abdurafiu Adeniji. He is the president of the National Association of Nurses and Midwives. We've been talking about the issue of the welfare and safety of nurses in the front line fighting against COVID-19. Now, the point there is about 10 of, in fact, there are reported numbers of frontline workers who are infected by COVID-19, and the issue of having access to PPEs as a personal protective equipment is in the front here. All right, I think we have Comrade Abdurafiu Adeniji back on now. Yeah, you were making a point earlier before the line went off.
Yes, I was trying to explain that though money were budgeted, there were donations from public spirited individuals, but the inability to provide the needed tool like PPE and roll out the benefit of this PPE for our members has created a lot of gap. It makes an individual to start thinking that is this plan or the plan that the government have on ground will be beneficial to the healthcare professionals? And basically, in the mind of everybody, what we should be what will be the rightful thinking of an individual is that this thing is not impacting well. The inability to have PPE is creating a lot of issues. And you know, what the healthcare system incorporates includes the policy of government, provision of services, healthcare personnel, infrastructure and equipment. If all these four things are working together successfully, then the health sector will be going on without disturbances. But what we have on ground presently is that there is PPE provision only for those places where there is treatment of COVID-19, the infectious disease hospital, but it's not everywhere in Nigeria. And that the danger is that anybody that come across any COVID-19 without the use of PPE, such a person is at greater risk. And this is creating a lot of challenge presently on ground.
All right.
Many teaching hospitals, department of OPD, except the COVID-19 treatment center or the isolation unit.
All right, Comrade, let me interrupt you a little bit. Now, the point there is we are where we are already with the challenges here and there. And you talked about the issue of the fact that the health system has been exposed and we can see some of the shortfalls. But on the side of the health workers, the nurses themselves who understand the system and who understand what time of the day it is, what are nurses doing by themselves to ensure that they protect themselves against COVID-19?
Well, this is a very good interrogation into the issue, and presently, even from the inception of the occurrence of COVID-19, Nigerian nurses and midwives have prepared their mind. That's the first thing, our commitment, that we are going to participate, we are going to be in the forefront of this battle against COVID-19, and we are going to win the war. One important thing that is there is that even if all these things are there and people are not convinced, they are not committed, there won't be any effectiveness. But Nigerian nurses are committed, they are convinced that we have to work for to battle COVID-19. Another thing is that nurses and midwives have undergone a lot of organization and reorganization. COVID-19 does not warrant that people should be coming together. Many people should be on, will be intermingling. As a result, both of the nursing department hospitals.
Yeah, Comrade, I'm afraid. Comrade, I'm afraid we'll have to leave it here for now. This conversation is certainly going to continue as we get along, talking about the safety and welfare of frontline workers at this time against COVID-19. Thank you very much, Comrade Abdurafiu Adeniji. Let's remind. All right, joining me right now on Skype from Abuja is the president of the National Association of Nigerian Nurses and Midwives, Comrade Abdurafiu Adeniji. Comrade Adeniji, it's good to have you join me now. Now, we all understand the level of challenge, and certainly you will all have the depth and the extra information here and there, but we have a fair knowledge of the inadequacies in the health sector. But if we have to change things now, where should really the government start from?
Thank you. It's a collective responsibility. The government and even private sector, we need to form a synergy, like I said, to ensure that what is expected in the health sector are put in place. From the side of the professionals, especially our association, we have started and we have commenced the provision of some of these equipment that our resources could carry us. Our last count has shown that Nurses and Midwives Association throughout the Federation have donated personal protective equipment and certain tools that are needed to combat COVID-19. On the part of the government, we should sit down to actually look into our policy. Let's do an appraisal of our public health policies and know where gaps are and where to fill in the gaps. Another thing the government should be able to do is to ensure the involvement of the professional associations, plan along with the professional associations, don't plan for them. And this is reflecting in the effectiveness of all the activities that the federal government is doing on this COVID-19. The federal government should use all the bilateral relationship to ensure that qualitative PPE are imported into the country and that the indigenous ones that are being done meet up with the standard, the international standard. If we can do this, with the production of PPE in Nigeria here, we are going to have enough, or if it is not enough, it is the one that is left, the gap that will be imported into the country. But
all right.
As we add,
Comrade, you talk about the issue of the PPE. Is PPE the most central equipment that is needed by health workers to stay safe from COVID-19?
Yes, PPE is very important. It's key because in the healthcare system, we have infrastructure and equipment, which is very important. You can train a personnel. If that personnel does not have infrastructure and equipment, there will be problem of implementation and effectiveness of the services being rendered. PPE is like if you don't have PPE, it's like not giving an army the ammunition and bulletproof, and you ask that person to go and face Boko Haram or any other war. It is what we use, at least optimally, to ensure that we are equipped, we are protected, because the infection of an healthcare professional is a drawback, is a setback in the healthcare system. We are talking about this personal protective equipment because it is the one that will give us the assurance that yes, we are equipped, we can with safety, caution, attend to a COVID patient. Without PPE, there is nothing we can do. Other thing that can go along with PPE is highly developed in ICT. If ICT is well developed, then nurses and midwives can interact with patients, monitor the health status of the patient without actually undue exposure to this to the patient and to the virus. There are places where there are monitors that can show us what is the health status of a patient, but in Nigeria, this is not available. Along with this PPE and the ICT is the motivation that will make the people to be convinced. A morally dejected nurse or any other healthcare professional can commit mistake at any point in time. As a result, this motivation is also needed from the government to ensure that we have the best of the system.
All right. Comrade Abdurafiu Adeniji, thank you so much for talking to us on TVC Breakfast.